So the big thing with the back is you need to think about what created the injury or the pain in the first place, or what postures or positions are aggravating your pain. So for a lot of people, the pain came with a bending and a lifting or a rotation component. Same thing during the day. You might find pain with bending, lifting, maybe twisting, rolling to get out of bed. These are all signs that these are motions that the spine is really just not looking for in the moment. However, what's pretty common is that when people have this pain, what they're always doing during the day is they are rotating, they're self-manipulating and twisting, they're bending, they're looking for this sensation of relief, which they often get because the muscle provides that sensation of relief, the manipulation at the low back provides that sense of relief. However, what you'll find is that the pain will continue to come back, and sometimes will come on stronger as the day progresses or later in the day. And oftentimes that's because you keep doing the same thing to your back that injured it in the first place. So what we need to do is we need to be very good about spine position throughout the day. A lot of times eliminating or stopping doing that thing that's actually aggravating the spine is the best way to make it better. From there, the other thing we want to do is we want to create that stability that the spine craves. The low back is built to be stable. It doesn't like a lot of bending, twisting. However, that motion is supposed to come from the mid upper back. It's supposed to come from the hip joints, but we want to learn how to stabilize the low back. This is why things like core exercises have become popular. However, we need to make sure that we're doing core exercises correctly. We need to make sure that we're not doing ones that are actually overloading and aggravating the spine too early on. And that's where a lot of times we'll start off with more gentle motions, which I can talk about at a later date. However, the other important thing is every movement that you make is a chance to work on spine stability. So if I'm going to bend over to pick something up, right, I can work on a good back position. That could be here, which is most of this motion is coming from the knees. It could be here, where most of this motion is coming from the hip joint. It could be a combination between the two, where now I'm getting, this is knee motion, this is hip motion, this is knee and hip motion. Okay, the other thing is we can actually use the muscles to help stabilize the back, right? The muscles are built like a corset. We can stiffen them to help stabilize the back. The way we do that is bracing. So we would stiffen as much as we need. We would modulate it as much as we need to. So a little bit if you're lifting something very light, right? Much stronger if you're lifting something heavy. And all that is you're gonna stiffen up almost like someone's gonna give you a little punch in the sides or in the stomach, right? We're not sucking in, we're not pushing out. A little stiffen. If you put your fingers on the side, you'll feel the muscles kind of bulge or tense into the fingers some. From there, if we're doing a squat, we are stiffening and then going into the squat, not releasing until we get to the top. If we're doing standing on one leg and bringing a leg out to the side, we're keeping the spine nice and straight, right? While we're doing a light brace, if we're lying on the ground, raising the leg, I'm trying to keep the back straight as I raise the leg. I'm only going as far as I can before the back wants to start to move, but I'm incorporating that brace all the way throughout. Same thing if you're doing a lunge, if you're doing a plank, side plank, we're adding that stiffness and we're doing as much as we need to based on the perceived difficulty of the activity. Now, what do we do if we're really craving that sensation that we need to move, twist, bend, right, for the pain? These things are okay, but the way that we typically want to do them is if we're going to bias ourselves into a position, a lot of times we want to go into a little bit more of an extension motion where you feel like the hips are moving forward and you're getting some extension at the back. If this aggravates you, what we'll do is we'll eliminate it. The alternative would be lying on the ground or on the bed flat on your stomach or on your back, whatever's more comfortable, 1 to 2 minutes. Right, as you progress, you could lie on your stomach and you could kind of just prop up on your forearms a little bit. Right, still hips, stomach resting on the bed or on the floor. Relax there for 1 to 2 minutes. And then the other one would be a cat-cow motion where you could set up on your hands and knees. Right, so we're going into another position where the spine is not loaded, it's offloaded. And from here, go ahead and get that rounding sensation that you're looking for and that arching sensation where you're getting motion through the spine, where you're stretching the muscles. But that would be the safer way to find relief.